Greetings, class, and welcome to Module 4. I wanted to take just a few minutes of your time to provide you with an overview of Chapter 13, the ethics of epidemics, as well as Chapter 14, the ethics of disasters. And so much of the content across this course, and in particular, these two chapters can be related back, dovetails nicely with what was experienced with the recent COVID-19 pandemic. So let's talk a little bit about the ethics, the ethical challenges that were encountered during the COVID-19 pandemic. And indeed, there were a number of medical, legal, and ethical challenges brought forth with the COVID-19 pandemic. Now, one of the first challenges that presented itself was the number of tests. Decisions had to be made very early on which members of the population should have access to the tests first. It was not always clear on where the line should be drawn, and policies and recommendations evolved as we learned more and tests became more readily available. But remember, in the beginning, tests were not readily available to all individuals. One of the next issues that surfaced during the COVID-19 pandemic was how positive cases should be reported to both protect the privacy of the individual, but then to protect the health of the nation. Did maintaining the privacy of the individual do more harm to society? In the beginning, many healthcare organizations were not prepared to meet the needs of healthcare professionals at the bedside. So then, what were the professional responsibilities of the healthcare provider in treating patients with this virus? The professional responsibilities of treating someone with this virus when we have adequate personal protective equipment was pretty clear. We understand our professional responsibilities. But what about when the personal protective equipment, PPE, was not available? What were the professional obligations of the healthcare professional? Was it ethical to ask a new mom or an elderly nurse to provide care to a patient with COVID-19 when adequate PPE was not available? Consider, for example, the nurse who was caring for a parent, perhaps, who was immunocompromised, and then was being asked to care for the patient at the hospital when adequate personal protective equipment was not available. So there were many more ethical and legal challenges associated with the COVID-19 pandemic. Of course, there were many questions raised on the allocation of scarce resources, including ICU beds, ventilators, and at times certain medications. Your book discussed in times of catastrophe, there is more of a utilitarian approach. What do you think? So the COVID-19 pandemic, again, we know, presented many challenges to healthcare professionals, but those challenges were also presented to patients and families. We know that during the pandemic, that family-centered care was impacted tremendously. We had residents who resided in long-term care facilities and patients who were hospitalized who were not allowed visitors. So what are your thoughts? What are your thoughts there? I want you to take some time to review the questions that I posted in the discussion board. You might also explain what are the next steps in increasing preparedness for disasters. So you might think about answering that question in addition to one of those questions that I posted in the discussion thread. It is important that you recognize, and your book talks about this, it's important that you recognize how past public health epidemics have helped inform us today and how past public health epidemics have contributed to public health changes. So what are your ethical obligations with respect to being prepared? It's important to ask yourself, what is your organization doing today to help improve practices should there be another epidemic? Okay? What are your responsibilities along with that of the healthcare organization? I am looking forward to a very interesting and engaging conversation this week in light of this topic. If you have any questions or concerns, please do not hesitate to reach out to me, and I look forward to seeing you online. Thank you.